start. 2, 1.
And there she goes. New Shepard has cleared the tower on its way to space.
My name is Dr. Eiman Jahangir. I am University of Tennessee Health Science Center class of 2005. I'm a physician, a cardiologist, and I am the first physician to ever go on a commercial space flight, flying last August 2024 on Blue Origin's New Shepard 26 rocket. There's a lot of reasons I've wanted to go to space. One is that childhood fascination and dream that we all have, right? Which is we imagine being an astronaut. I grew up in the shuttle era. And then as I got older, working at places like the Adventure Science Center, which was a science center in Nashville, Tennessee, I was able to actually act like I lived on Mars when they had a Mission to Mars exhibit come through here. So I had kind of the upbringing of space being all around us, and then this defining moment in my high school where I experienced that. Finishing medical school, I realized this is something I needed to pursue. So I feel that drive that many humans feel, which is that drive to explore, that drive to push yourself, to challenge yourself. And for me, space was that ultimate kind of experience. You know, I wanted to go out and see what's out there and what's up there. And for me, that was one of my personal drivers of going to space.
Wow. Wow. Remember
This is unreal.
I would say the biggest impact coming back from space has had on my day-to-day work is a lot of patients ask me about it because they Google me on the internet. And so it gives us a good way to break the ice when you're meeting someone new as a patient the first time. I feel very fortunate that I was able to go to University of Tennessee Health Science Center, particularly in Memphis, Tennessee. In a lot of ways, I think my time in Memphis shaped who I became and also gave me the tools I needed to deal with adversity. By being in medical school in a place that provided training and teaching under those circumstances, I really was given both a strong sense of you can do anything, if you have the right guidance and you train, and you really aren't limited by what's in your mind. You're more limited by just what you can dream of. And also it gave me a strong foundational knowledge in medicine, right? I mean, I remember even as a first-year student, suturing patients in the emergency room under supervision. I mean, that was an amazing task. So even early on, I was getting hands-on skill on how to be part of the team, how to care for people. Who I am as a doctor was foundationally based on my time in Memphis at University of Tennessee Health Science Center. I would recommend for everyone to go to space. It's interesting, though, if you ask people if they're willing to go to space and you ask a group of adults, it's about 10% say they would go tomorrow. Now, if you ask a group of kids, it's about 100% are ready to go tomorrow. And I often wonder what happens from when we're young to when we're old. Some of it is sure we have a more basic understanding of the dangers of going to space, but I also think we sometimes give up on those dreams and those passions that drove us as children as we get into our careers. So one of my biggest things is how do we regain that passion in our professional careers? How do we regain that passion in our 30s, 40s, and 50s so that we can jump on that rocket and fly to space like those kids are ready to do?